a small business. Down in Milford we have, it's a consulting business. We also do training and develop training. We have artists and computer people that work with us. And we have to insure them, obviously. And it costs us a lot of money. Last year it cost us close to $50,000 to insure our group of people. And this year it's costing us half as much. Why? Because I'm taking over a deductible, a gigantic deductible, that I'm not making my employees pay, but I decided to pay it myself. In other words, I'm taking over some of the risk associated with it to keep the overall costs. Risk that I thought was going to be pretty decent for a while, except for two people got very, very hurt this year, and so they're cutting into it a little bit. Not so bad. But now, again, the small businesses have to take on the risk. We pay our employees, 100% of our employees insurance, and we do that for a reason. I know a lot of companies don't and can't really afford to do it, but the reason we do it is because we want to provide them the best coverage, number one and foremost, and we don't want them to be afraid to use it. We don't want them to have to be afraid to use or to have to pay a copay. I don't know how many times people told me that they didn't want to pay the $30 copay or whatever else. And that's the reason they weren't going to the doctor, or they didn't want to. They hadn't reached their deductible yet, and that's the reason they weren't going to the doctor. So we pay 100% of all that, and we even pay whatever the deductible amount, which is very high at this moment as well, back to the employees that they pay out. I'm in the Chamber of Commerce in Milford. And in the Chamber of Commerce, we get CPIA comes down and visits us and tells us all about the horrible things that people are trying to push on them up in Hartford, having to do with health care. And I just have one of their flyers here, and it says this, to reject certain things, reject knee-jerk reactions to health care, the health care problem. These ideas, these reactions lack innovation and efficiency. Okay, they are costly and unsustainable, unlike, I guess, what's going on now. They promote, they don't promote healthcare. They promote rationing doctors and doctor exodus. In case you didn't know that, this is what you guys are promoting here. A single payer system in Connecticut would be costly and unsustainable, since the private sector would no longer be available for hospitals or other providers, which is not really true. A statewide personal pool, definitely. Large health insurance purchasing pools do not significantly reduce health care costs, since they do not address the fact that medical care is very expensive. Okay, it doesn't address that fact. The pool doesn't address that. These are complete and utter nonsense, okay, that they're handing around to these people and at the Chamber of Commerce. And to tell you the truth, to their credit, most people in the Chamber of Commerce are small businesses at this location, and they actually didn't buy any of this. Some people, a number of people, asked questions. They said, well, I can see what you're against. What are you for? What's your plan? What's your idea? And really, they had very little. They had hardly anything. Actually, I think something about keeping the paperwork down somehow, photocopying it or something. But in general, they weren't really doing anything. And so, really, in Connecticut, we need to have eventually a single payer system. I definitely think that would be the case. Should be the case. The pool was going to be a fantastic idea that Chris Donovan put forward, and I think it should get a try again. Now he's going to be the speaker, which is the greatest thing. Yeah. I think we should just ask Chris to push that again, and I think this time we can get it through with a new crew up there in the state legislature. Thank you.